Bismillah ar-Rahman ar-Rahim. Today I would like to introduce a case presentation, refractive case presentation, and to give a simple information about how to plan your flap in faint superficial peripheral corneal scars. Male patient, 25 years old, came for refractive surgery, no past medical or surgical history, no history of glasses or contact lens. He doesn't like to wear glasses at all. Refraction, as you see, summary of this refraction, that post-cyclo refraction is seeing better than pre-cyclo, but still improvement of vision not so much, as I forgot to write here, uncorrected vision in the right eye 2040 and in the left eye 2050. So 2050 to 2030 not so much improvement, or 2050 to 2040 not so much improvement, it's just one line, but in the right eye 2040 to 20 is a good improvement. So right eye, we don't have a problem in the right eye, but I have a problem with the left eye, that no so much improvement in vision. So I give him glasses and I advised him to wear it 2 weeks to check improvement of vision with glasses, and he came after 2 weeks seeing corrected visual acuity in the right eye 20 and in the left eye 30, and again he is insisting to do surgery. By examination, the left eye has a nasal corneal scar 2.5 milli from the center of the cornea. Otherwise, no abnormality could be detected in both eyes within anterior or posterior segment. Anterior segment OCT shows a direct nasal scar reaching 160, almost 160, but denser at a superficial layer and fainter at deep layer. So the maximum density is at 130 micron depth. This is the shape of a scar, or faint scar. As you see here, the only problem you can face as a surgery, that the laser would not transmit this scar, and maybe buttonhole would happen. So I planned for him to do the left eye first, or left flap, and I noticed the laser. If I suspect of buttonhole, I will postpone the surgery, and I discussed this issue with the patient, and I planned to do the nasal hinge and 130 flap. And I calculate also, I saw that the meridian of the ablation is 145 and the scar is almost at 180. So, and the scar is doing flattening, and in front of it steepening, almost reaching 49.5, and but the ablation will be away from the scar. I will tell you later in the next slide about it, but let's see the operation here. This is the image one day post-op. If you see here, this is the scar in the nether area, and this is the edge of the flap. This is the topography. The left side is the pre-op, and the right side is the post-op, and the lower is the difference. Left side, if you see the black arrow, the black arrow here is the flattening, and in front of it is a steep area. So here you have to know what is the meridian that you will work on. So the meridian is, as you remembered, 145. The flat meridian is 145, is here. So it will ablate, or it will steepen this area, so it's away from this area اللي already see. And the this is a map post-op in the right side. Yeah, this for pre-op in the left side was 49.5, and in the right side is around 50.1. So not so much steepening happen here. So you will the machine work on the flat meridian 145 and steepen this area. As you see in the different map lower, the red arrow is the meridian of ablation. So this map showed that meridian is away from the scar. If it is in the line of the scar, so maybe I will not be encouraged to do this surgery, but it's away from it, so I'm encouraged to do for him. This is the anterior segment OCT, spectral domain OCT. Here is the depth of the in the center area. The depth of the flap is 127 or around 130, so it's a reliable flap. And the scar is reaching almost 160, and superficial in the lower layers and in the deeper layers, and a little bit denser in the superficial layers. One day post-op, uncorrected was 20 in the right eye, 20 in the left eye, and the patient is very satisfied. And 1 month uncorrected 20 and 22 in the left eye, and I told the patient that the left eye is always weaker than the right eye, and no so much improvement, but after surgery actually it improved. And 1 month manifest refraction in the right eye plus 0.25 minus 0.25 axis 90, and is seeing 20, and the left eye minus 0.25 and see 22, and the patient is very happy and satisfied. So we have also we have always in the while doing surgical planning in cases of corneal scars, we have to know the location of the scar, we have to know the thickness and density of the scar, because maybe Femto laser will not transmit this scar and they cause serious problems like buttonholes, and you have to calculate the ablation and know the meridian of ablation. Thank you so much about listening this presentation. I hope it will be informative and helpful for your work. Thank you so much.